after knowing how to prevent cancer, now it's time to know how it is diagnosed. The next question that we've gathered from our lovely audience here is that how is cancer diagnosed at the very first place?
Most of the cancers are diagnosed usually by a tissue biopsy test. Biopsy test means taking a part of the tissue from the body, which can be either through a needle biopsy or fine needle biopsy, or taking a piece of tissue during surgery. So without that, usually most cancers cannot be diagnosed. Some cancers like blood cancers can be diagnosed just by examining the blood and doing special tests on it, but otherwise we have to rely on tissue biopsy. Apart from that, we need to do some other investigations as well regarding the fitness of the patient and also the stage of the cancer, which I will come later. Those are the other tests, but for the diagnosis we need to do a biopsy and place the tissue under microscope under a pathologist, who will then do various tests on it and confirm if it's cancer or not and what type of cancer it is.
Well, now sir, there is a question that has come up from our audience, that we all have this confusion that there are many patients who come by and once biopsy is told, the very word biopsy dreads them. Few people are scared to do the test. So can you please elaborate, like, is there any harm that is caused to our body if biopsy is done?
Yeah, this is another common myth in our society, that once we do a biopsy the disease will spread. But actually it has never been proved to be so. We always do biopsies and we diagnose patients on the basis of that biopsy and then treat them, and they can get better. So if the disease has to spread, it will spread with or without the biopsy, and if we do not do the biopsy in that case, then we do not have any treatment also for that patient. So biopsy is very much necessary, and we should not have any fear about biopsy. We can take enough precautions to do a safe biopsy.
Thank you so much, sir.